Hello and good afternoon, everyone. Thank you for joining us for Western Wednesday with the College of Health and Human Services. This afternoon, we have a few guests that's going to be joining us. We have Allison. Allison is one of our speech pathology students.
Public health
Students, I'm sorry. And then we also have Dr. Bob Bensley, who is going to be our featured major on this afternoon to talk more about the public health program. But starting out, I do have a presentation that I would like to show you briefly regarding the various programs that's available within the College of Health and Human Services, just as well as some few highlights regarding our colleges and experiences that our students are able to partake in. So please kind of sit back and just join in, and we look forward to any questions that you may have. You can feel free to put those in the Q&A section. So again, just sit back and relax, and we look forward to answering any questions and providing as much information for you as possible on this afternoon. So at the moment, I'm going to share a PowerPoint. And I hope you guys all see it. Because I sure don't. Okay, so the College of Health and Human Services information session. So again, thank you for joining that with us on today. Just to give you a little information about the College of Health and Human Services, we have programs that are definitely in high demand. These professions we serve are strong and growing, so there's definitely a need for them. And as a College of Health and Human Services graduate, you will be prepared for a career in which you will be in demand. So that is definitely a good thing. We want to make sure that as we are pursuing these different majors, you will have a major where you can land a job in the end. High satisfaction careers, our students have you've decided to make a difference with your professions in the various fields that you've chosen. We have careers that are high touch, and they're incredibly challenging and deeply satisfying. High reward from the various programs that we offer within health and human services. So beyond your personal satisfaction, healthcare and human services careers often come with relatively high starting salaries. We have unsurpassed impact. We are impacting the university in our professions with research and engagement. You will impact individuals, families, your community, and even more as a College of Health and Human Services student. Our college consists of schools and departments. The various departments that we have are the Blindness and Low Vision Studies program, and those individuals will graduate and have jobs as vision rehabilitation therapists or orientation and mobility. We have a department in occupational therapy, and of course, those individuals will be occupational therapists. We have a newer program, our physical therapy program, and those individuals will be doctor and physical therapists. We have a phenomenal physician assistant program, and those individuals are working alongside medical doctors. And then we also have our speech, language, and hearing sciences department, and that is housed under the Audiology program, our doctorate program, just as well as our speech and language pathology program as a speech pathologist. For our various schools, we have a school, the interdisciplinary health programs. We have several programs listed under the interdisciplinary health programs. That's where our featured program today, public health, resides. We also have programs in gerontology, addiction studies, holistic health and wellness. Again, those are all programs under the interdisciplinary health programs. And definitely last but not least, two other programs we have, social work and a nursing program within our college. Within the College of Health and Human Services, we have 5 of our graduate programs that are nationally ranked as some of the top of its kind. So of the 100 programs of this kind within the United States by the US News and World Reports. So again, we have 5 graduate programs that are nationally ranked. So some of the tops of its kind. With that, we have our occupational therapy program. That is number 32 in the country. We have our social work program. Out of 100 various schools and program of its kind is number 77. Our speech pathology, speech language pathology program is number 46. Our audiology program, not too far behind, number 48. And our rehabilitation counseling program is number 37 of its kind in the country. So again, very prestigious programs, well-known programs with excellent reputations. Through the College of Health and Human Services, all of our students will participate in clinical opportunities, observation opportunities, practicum field experiences. And there's also opportunities for students to do research with some of our outstanding faculty. To that end, we have unmatched clinical opportunities for our students. We have partnerships with the Unified Clinics and Center for Disability Services. That is a unit that is connected to our college. In fact, our students participate in more than 300,000 hours of service to our students and families in the community around the state and also across the country. And also with the Unified Clinics and our Center for Disability Services, our students serve over 1,800 patients a week. So that's roughly about 80,000 appointments annually that our students are gaining some wonderful clinical experiences with some agencies that's connected to the College of Health and Human Services. And our graduate and undergraduate students, they're involved in faculty research. So not only is it important to gain some practical experiences, you want to make sure that you're building that resume and also setting yourself apart. So if that means continuing your education or working in the profession, again, you want to make sure that you're gaining some hands-on experiences. And then also that you're actively adding to your knowledge base in your chosen field. So individuals who go into health and human services usually are excited about being lifelong learners. As students in the College of Health and Human Services, you will take advantage of some of the preclinical opportunities for learning. We have technology, some of the phenomenal technology. We have an anatomage table, as you see the picture there. We have great opportunities for our students to even gain jobs, to be a coach with that anatomage table. But even so, if you don't want to be a coach and you just need that little extra help in anatomy, that anatomage table will become your friend. We also, in the middle, we have the Sim Man. That is a structure that we use that costs well over $90,000. So it's a great tool that can translate into both male and female. So great opportunities for our students to gain those preclinical hands-on experiences. And then you'll see that our nursing students in that last picture there with the 3 ladies with the baby, that's our Sim baby. The Sim baby is there, again, a wonderful clinical tool for our students to use as they're looking to gain skills to be able to use once they go into the actual healthcare setting. And on the lower pictures, we oftentimes have higher end individuals who will be volunteers, so to speak, for our students to get some experience with real people with real conditions, or even sometimes they may assimilate different conditions, and the students have to try to figure out what type of treatment an individual should gain. So there's a lot of different opportunities for the preclinical teaching that's available for our students. Now, I've been talking a lot about clinical types of majors or professions that's within the College of Health and Human Services. So our featured program today is going to be our public health, which is a non-clinical opportunity, and we do have other non-clinical opportunities as well within health and human services. But today's focus is on public health. And you may be asking, what is public health? Public health is a discipline that addresses health at a population level. And what do public health professionals do? They understand, they gather information and evidence to inform us on how we should act, and then act on that understanding. So the ultimate goal is to keep healthy people healthy, ensure unwell people have access to care and treatment. Does anyone have any questions that they would like to type in for us in the chat for the moment? You can feel free to start typing those questions in, and we will address them in just a moment. But one other slide that I would like to share, for the various programs that we do have that I mentioned earlier within the College of Health and Human Services, these are our various undergraduate academic advisors that you can email to ask additional questions to after this recording. So you can feel free to take a screenshot of that, a picture of that, but it would also be available after today, and you'll receive more information about that. So I'll let that stay there just a couple more seconds, and hopefully you're having an opportunity to type in any questions that you may have so we can chat with you in a moment. However, at this time, I am going to turn this portion over to Dr. Robert Bensley. He is one of our professors within the College of Health and Human Services who specializes within the public health sector. Dr. Bob?
Thank you, Melinda. And there is one question that came in from Brooke. She is asking, can you talk about social work, which you did, and I'll talk a little bit more about that. But what are the general education classes that she would need? Do you want to give her some direction on where she could find that, or what her next step should be?
Thank you, Bob. Thank you, Brooke, for that wonderful question. For social work, because we have other majors on the line or on the call on today, I would love to encourage you to reach out to our social work advisor. Her information is listed right up there. So I need to add that. Her name is actually Jill Hamilton. So jill.hamilton@wmich.edu. And she will be able to answer any questions that you have regarding the social work program, just as well as general education classes that's required. Again, Brooke, thank you for that question.
And there are two more questions that came in. If you want to bring up your Q&A, probably you should respond to those as well.
And Victoria, thank you so much for the similar question, seeing that you have an interest in OT. Again, I would truly recommend that you reach out to your academic advisor. Her name is Miss Sheena Bolton. And again, on hopefully you took a picture of that, but it's sheena.bolton@wmich.edu. And at the end of everything, I will attempt to put that information back up again so that if you did not take a picture, you'd be able to take a picture later. And again, you can reach out to your academic advisor. And Abby, to answer your question just before Dr. Bob comes on, your question is whether or not there's any new information regarding the accreditation status of our physical therapy program. Very good question, Abby. So with our physical therapy program, the program just started last summer. So we don't have information regarding the accreditation status just yet. Normally there is a process, a few years before that information will be available. Currently we are in candidacy, of course, but however, as long as we're in candidacy, a student would be able to go through the program and sit for the licensing exam as needed. I hope I answered your question.
And I could add to that also. With accreditation, as Melinda had mentioned, it's exactly right. The program has to be in place until it graduates its first cohort. And then as that cohort goes out into the field, then there's evidence in relation to where they were placed, job placements, internships, et cetera, which is all part of the accreditation process. But it's fully, the process is in place for the program to be accredited, but because it's brand new, it has to wait in order to gain the information and the data. Okay, so you've turned over to me. One thing I would like to mention, if you noticed on that last screen down at the bottom, we have College of Health and Human Service student ambassadors, and that's who Allison is in the picture in the screen here, the one that looks much younger than Melinda and I. She is our student ambassador. She's a public health student, and actually, why don't you share a little bit, Allison, about what you do and what services you can provide, and if they have any questions that they want to connect directly with the student ambassador, how they could do that.
Yeah, thanks, Dr. B. So as you know, I'm a public health student, and we have ambassadors in all the other majors that are students as well. So if you look at the email, it's the CHHS_MBASS, AMBASS, at wmich.edu. So you can talk to someone about what a day in the life of maybe a speech path major looks like, or if you want to talk to a social work major and see what maybe minors they've taken up. Those are common questions we get. As far as my role, I typically give tours, but due to our current situation, all of our Q&As are online right now. So if you want to schedule virtual chats with us, then go right to that email as well. But when the college is functioning in person, not only do we give tours, but we also work in the student success area, as well as helping with the anatomage table. I was training to be a coach for that before things went online. And we also work in like the dean's office too, and just miscellaneous committees in the college as well. So it's an amazing student job, and we're always looking for people to help out with that. So thanks, that's what I have to say. I'll answer any student questions that come up as well.
Thank you, Allison. And definitely, if you have questions, Allison, you kind of monitor the Q&A there. She is a student here, so you probably want to hear more from her than you do from us, because she can tell you the real story in relation to what it's like. Okay, what I would like to do is I would like to share where all of our programs fit in relation to how they connect with each other. And so I'm going to spend a little time here talking about PTOT, social work, public health, etc., in terms of levels of prevention. So we all work together in the process of trying to keep people healthy. And that's what our entire college is about. And our different disciplines really are cousins of each other. We connect together in a lot of different ways. We overlap in a lot of different ways. And we are all of us together are the healthcare team for the population. So when we talk about levels of prevention, we typically have 3 different levels: primary, secondary, and tertiary. A primary level of prevention is the idea where we are trying to prevent disease and disability from happening in the first place. And that's typically where public health fits in. As Melinda had indicated, public health works at a population level. So rather than working one-on-one with a client or a patient, we work across all populations trying to keep them healthy. So during the current crisis that we are in, which we all know, the COVID-19, and that is the biggest public health pandemic that we've ever had in our lifetime, and hopefully we ever will, some of the different primary prevention techniques happening is the concept of social distancing. Sheltering at home, that is a primary prevention technique. And if you listen to Dr. Fauci, Dr. Birx, they are public health professionals. They are promoting and driving this whole process of let's incorporate social distancing, let's wash our hands, let's cough into the elbow, let's wear masks, etc., because those are all primary prevention activities. And that messaging typically comes out from the public health field, because we are trying to protect the mass population in public health. Other examples of primary prevention might be trying to get people access to healthy food so that they don't end up obese or increase childhood diabetes, which will result in disease processes down the road. The concept of reducing or banning smoking in bars and restaurants as a policy, a health policy. That is a primary prevention technique because it prevents people from having smoking-related behavior or smoking-related diseases. Seatbelt laws, that's primary prevention. So when you think about it, all of the different things that we put in place to try to prevent the problem from happening. Then we move into secondary prevention. Secondary prevention typically is the early diagnosis and treatment phase. And so you have a sore throat, you go to the doctor, you might be given a medicine. That is a secondary prevention technique. We have a number of majors that typically fit within that environment. So we have nursing, physician assistant, social work, health services, which would be working in health clinical areas in relation to administration of health services. So these are typically secondary related. So there has been a disease or an illness or a disability, but if we catch it early, we can treat it and we can change it. Now, tertiary, that is typically where the rehabilitation phase comes in. So there's been a major injury or disease process, whether it's a heart attack, cardiac arrest, or whether it is a spinal injury or whatever it may be, or there's a disability that you can never go back and change that back to where it was before. But improving the quality of life from that point forward is what these disciplines are involved in. So typically physical therapy, speech audiology, occupational therapy, blind vision, those are all rehabilitation related. So if you look at this whole big picture, this is what our college does. Now, we don't just fit into these clean little bubbles because life isn't that way. So each profession tends to cross over into multiple prevention areas. For instance, I mentioned primary prevention, and public health is the major piece in the primary prevention area. However, we still have nursing that works in primary prevention. The concept of immunizations, that's a primary prevention technique. And so we have medical fields that do work in primary prevention. Same thing with tertiary, typical rehabilitation fields. We have injury prevention specialists. They could be occupational therapists that are working in primary prevention. Secondary prevention, same thing, public health works in secondary prevention. Early screening and treatment is a public health technique. Example, what we're doing with COVID-19. We are in the process of trying to get enough screening so we can identify individuals who are infected so that we can get them in for treatment. That is a secondary prevention technique. Social distancing is primary. Secondary would be the screening process. Tertiary would be the ventilator in the recovery of the damaged lungs after that process in the whole COVID perspective. And then also in tertiary, we have medical that works in tertiary. It isn't just the rehabilitation services. We have public health works in tertiary, maybe in Alcoholics Anonymous. Social work works in tertiary in terms of working with families that may have had abuse or other social determinant problems that are ongoing and long-term that needs to involve social work in that area. So those are an example. I just wanted to share that because that gives you a picture of how all of our programs fit together and how we cross over with each other. As Melinda mentioned, what I'd like to do is just to spend a little bit of time focusing on public health. And I think this is a perfect time to talk about this major because it is the issue of the day. You've probably heard public health, the phrase public health, more than you've heard anything in the last 4, 5, 6 weeks, because that's what we're in the middle of, is this public health pandemic. You may have remembered the last public health big news issue in Michigan was the Flint water crisis. That also was a public health related issue. So public health, in public health, all of these different tasks are performed. What you're hearing about a lot now is the surveillance and monitoring aspect of public health. Getting enough tests out there so we can identify who has COVID. We can identify who has the antibodies, so who might have been infected. So when we're able to expand the surveillance, which means that we're doing great monitoring and identifying individuals out there, then we can start to identify where are the pockets of the problem, where do we need to contain those, and how do we then not spill it over so we have to keep everything closed down, but we can identify the hot spots. That comes through this testing and surveillance process. Public health also works on a big area is health promotion, trying to help people change behaviors so that they don't end up with disease processes. An example of different public health issues that public health individuals work with. Here's just a list. And now I know this is going to also be on YouTube at some point in the future, so you don't have to sit here and write all this down. If you're like, wow, I'm really a public health geek and I want to get into all of this, you can review it later. But we work with diseases and epidemics and substance abuse and smoking and contraception and sexuality and chronic disease and safety and pollution and body image and food access and weight management, depression, anxiety, anything that impacts the health of the population is what public health works with. And so if you think about, wow, that's a lot of different things, there are a lot of different areas where public health individuals work. Every county in Michigan is tied into a public health department. that is responsible for the health of the population. You might have been hearing a lot lately about this idea of contact tracing with COVID. Contact tracing is gathering a public health workforce, or in this case, a volunteer workforce, who can be trained to be able to help identify when somebody has been infected with COVID. They can communicate and map out where that person has been in relation to other individuals and start doing some of that contact to help them contain from their perspective. That all is running out of the health department. Community organizations, American Cancer Society, American Heart Association, substance abuse prevention agencies, cancer agencies. These are all nonprofit agencies that work in public health. Government clinics and hospitals. Public health individuals work in hospitals as well. They don't work within the hospital because that's where dietitians and nurses and doctors and PAs and therapists and everybody else, they work one-on-one with clients. But typically what public health does with a hospital is they engage in the community assessment aspect, looking at what are the problems within our community, working out of the hospital, leading that effort in order to identify the hot problems, and then how can we address those with the different agencies and different disciplines that we have. They work in corporate work sites, so that the population of a corporate work site are the workers. So keeping the workers healthy and safe and fit and disease-free. They work a lot in insurance, health maintenance organizations. A health maintenance organization is responsible for keeping people healthy. They want to prevent any type of use of the healthcare system. And what better way to do that than to work with individuals who are specialized in primary prevention. And then there's tremendous opportunities international. You hear of US agencies like CDC, that's our government public health agency. The World Health Organization, that's the World Public Health Agency. So there's tremendous amounts of international opportunities available in public health. If you think about it, we are not that bad in relation to our health issues. When you start looking at some of the countries in Asia and Africa and some of the other areas where the public health systems and the medical systems are just nowhere near what we have in the Western world. And then we look, what are different public health jobs? Well, there are all sorts of different names for public health jobs, different areas of specialization. Nutrition educator, epidemiologist, public health educator, tobacco treatment counselor, community initiatives coordinator, certified health and wellness coach, sexuality educator. There's a tremendous number of job areas, because if you remember, there are so many different topical issues in public health that there are many different jobs that are geared toward that. Now, one of the really sad parts of COVID, in addition to people getting sick and dying, which obviously is ultimately horrible, it's the latent phase, or what we call the phase 4 of the curve. You see the curve, but you don't see this phase 4 curve. The phase 4 curve is the social ills that will come out of this. So once COVID is done, once we're beyond this, the individuals that have turned to substance abuse, domestic violence, they've turned to overeating, they've turned to a lot of different negative health behaviors. They have anxiety, depression, mental health issues through loss of income, loss of job. There's so many social ills that will be following us that we're going to need populations in a variety of our different majors. And so by coming into the College of Health and Human Services, you're really moving into all of these fields will be needed, heavily needed within the next 5 years because of just the aftermath of COVID in itself, on top of all of the other issues that we've already had. So you're moving into a great place for job, regardless if it's public health or OT or whatever. There's going to be many, many, many jobs opening. And that's unfortunate. We would rather work ourselves out of the business because that means then everybody's completely healthy. So looking at right now why a Bachelor of Science in Public Health, with the baby boomers who are going to be retiring, we have about a quarter of our workforce that is at that age that is retiring. They're leaving in this year, next year, the next year. They are going out. We still have the problems that we have, and we have more problems now with COVID. So those jobs are going to need to be filled. U.S. Bureau of Labor and Statistics has identified over the next decade that there's an 11% increase just in public health jobs itself. In addition to, we already know that nursing is in high demand in other fields as well. So again, you're in the right college in order for being able to move out into a career. With a job income, this is just specific to public health, and this is a bachelor level. Probably a starting income is about $45,000. Average is $56,000 in public health. And you can see that Michigan is sort of in the middle in terms of the income. East Coast, West Coast, obviously are going to be more expensive and they'll have higher paid jobs. But it is a career that has a decent avenue for moving up and earning a good income. And then lastly, I just wanted to share a slide of our public health faculty. We are a very diverse crowd. We are male and female, multiple races, international. One of our professors is from Canada. And so it's a very diverse field. We all have a tremendous amount of experience in the public health field. All of us have international experience as well. I've done quite a bit in South Africa, and we have different faculty who've done work in different areas. So we're able to bring that into the classroom. Part of what we also do in public health is we make sure that we take you places, we take you to national conferences, we get you involved in real experiences, contract work in the community, so it's not just classroom-based type of work. So that was just sort of an overview. I appreciate the opportunity to be able to share public health, especially right now amidst COVID, since it's on the top of everybody's mind in relation to, well, what the heck really is public health? So hopefully now that gives you a little more idea about it. If you have any interest at all in public health, my email is very simple. It's just my last name at wmich.edu. And then I also put up the student ambassador email once again, so that if you want to talk to Allison and get more information about any of the programs, she can connect you with an ambassador from any program, regardless of your interest area. So Melinda, I'm going to turn this back over to you. That was my spiel. And I appreciate everybody who is on this call. I think it's fantastic that you're not letting this keep you back, this whole COVID thing, but you're realizing I'm moving out, moving forward. I'm pursuing my degree, whatever it may be. We hope it's going to be at Western, and we definitely hope it's going to be in Health and Human Services. And personally, I hope it's going to be in public health, but we will take you in all of our programs. We're just glad to have you here. So back to you, Melinda.
Thank you, Bob, for that. Thanks to those who have been sending in a couple of questions on the chat. I've attempted to not only answer them publicly, but also to answer them, just to provide you a few more details within the chat. However, there was a very good question that came on. For someone who is possibly interested in pre-med, that leads me to believe that they might be interested in wanting to become a doctor. And oftentimes I would ask individuals, tell individuals, if you're interested in becoming a doctor, then the pre-med track is typically one that is might be best for you, because you're able to get more of the sciences that's needed, that's ultimately going to prepare you for that MCAT. However, I have students who will say, you know what, I want to make myself a little bit more well-rounded. So I can always build in those extra prerequisites that may not be a part of that healthcare services and sciences program, but I want to have a broader knowledge base than just the sciences. And if that is you, we can do that for you. So we have a little bit more flexibility in how we can meet a person where they are and help them get to that ultimate goal through that healthcare services and sciences program. So not only can we focus on the sciences that a pre-med student may need, But through the program, students will take classes that are tailored towards other things that will occur in health, within health, in the health systems. So in fact, one of the classes you'll take is learning more about the healthcare systems and its environments. Classes that deal with healthcare literacy, health policy, legal issues, healthcare practice management, just medical ethics, just a lot of other classes that will, again, make one a more rounded, not only student, but hopefully an applicant as you're looking to apply to medical school, if that is you.
And
I answered your question. That was a lot. And I'm more than happy to have a deeper conversation with you if you would like. And to that end, my email address, I will type that in the message, but it is melinda.lockett@wmich.edu.
And Melinda, Hannah had responded that she's interested in a physician's assistant, which would be perfect for the HSS pre-PA track.
Absolutely perfect. We do have the pre-PA track because at the end of the day, we have a wonderful PA program. Like I mentioned before, we're looking at home growing our own PA candidates. So PA, we got you covered with the Healthcare Services and Sciences program, Hannah. Thank you.
And then Abby.
Sorry, Dr. B.
Yeah, go ahead.
If I may add, also looking at if you do want to be a PA to set yourself apart for whatever pre-track that you're in, that I personally have 2 minors and a lot of people take advantages of the minors in the college as well. So you can get into integrative holistic health and wellness or health informatics and information management. We have a gerontology minor. We have all kinds of minors as well. So you can really focus in on what you like, and those are applicable for all the majors.
Yes, definitely. And Abby, you have a question whether or not the Healthcare Services and Sciences program is a good place for an aspiring physical therapist. Absolutely. You'll find with some of the programs that are graduate programs, it truly doesn't matter what your undergraduate degree is in. However, you want to make sure that you select a degree that is going to make you a well-rounded candidate. You're going to make sure that you encompass the necessary prerequisites that you need to apply to the program. And it is ideal if you're able to get connected to faculty that oftentimes roam around the halls of the College of Health and Human Services. Those individuals and even students can be individuals for you to ask questions about, what the program is like and what to expect, the application process and things like that. So the College of Health and Human Services definitely is a place for physician assistant students, just as well as students interested in physical therapy.
I can speak to that one. Alex's question, I'm not sure if I want to do social work or more of substance abuse yet. We have the specialty program in alcohol and drug abuse, which will prepare you to be a certified substance abuse counselor. So that is a minor that you can follow and you could add. So you could do a social work major with that as a minor. That's a great combination because they fit together. Or you could do a public health with a social work minor, or you could do, there's a lot of different varieties that you could connect together there. So Alex, that's a good question. So a lot of times what students will do is when they come into the program, they will take an entry-level substance abuse course, or an entry-level course that's focused more on social work. And then from there, they'll start to gain a passion in relation to, wow, I really like this aspect, or I really like these professors and this group of students that I'm with. I can just see myself doing that now that I learned more about that. And so with all of our programs, except maybe, well, no, I shouldn't say all of them, many programs at Western, you don't need to come in day one in that program. Now that might be different in nursing or some of the other programs, but a lot of times you come in the first year and you're going to take some of your general education and start pursuing some of the courses that you think might fit in your career decision. And then from there, you really kind of have a better idea of exactly where within the college that you want to focus your efforts.
Thank you for that, Bob. Yes, coming in even as a freshman is okay if you don't know, which is wonderful for us in the case of the social work and the substance abuse that you're interested in, Alex. We do have beginning classes, intro type of classes that students can take in those. And even so, those classes are also applicable towards general education, which is really nice. So if you decide that maybe one of those areas is not what you want to do, those credits are not lost. They'll still continue to follow you, and even better, also be used for you for general education. But by having some of the programs have an intro type of classes, it does, as Dr. Bob mentioned, allow students to begin making contacts with not only students, but some of those professionals, those faculty or professionals that are in those disciplines. So you can even begin mentoring relationships and maybe have those conversations about, hey, is it possible if I could job shadow you? Or if there's someone you know whom I can job shadow with, or maybe interview to get more information about a certain field of interest that I might be interested in within social work or within the substance abuse. So in working with your academic advisor and of course your faculty, we can help you make some of those connections. Allison, I want to pick on you for a moment, being a student and trying to have more of a student perspective. When you came to Western, and I hope I'm not putting you on the spot, so guys, she doesn't know what I'm gonna ask. When you came to Western, did you know exactly what major you wanted to go into? And now that you have declared a major in public health, why did you declare that, and how do you feel about that major at this point?
Okay, you asked a lot of questions, so I'll do my best to answer them in order. I was actually a transfer student to Western, so I started off in pharmacy school and realized that I really liked more of the prevention side of things after taking a public health class, and I absolutely love the field so much. I've had Dr. B as a professor for many classes in the faculty, and I really feel like public health was the absolute perfect fit for me. I mean, it's also great for people if they want to use public health and then go into other graduate programs, that it's nice to have that foundation, but I see myself staying in public health. I love epidemiology. I want to be an epidemiologist. So after taking my epi class this spring, that's my fit. So that's where I'm staying. And I've just added my 2 minors of holistics and health informatics. So really seeing myself in that field and being extremely happy to be there, and definitely needed now more than ever. So I don't know, did I answer everything?
You did a phenomenal job. And yes, you're right. Using those holistic health techniques are very beneficial right now.
Mm-hmm.
Jenna is asking a question. She's interested in speech pathology. Jenna, we're definitely glad to have you on the line, on the presentation with us today. And you want us to explain the benefit of having a minor, and do I have to choose a minor as a freshman? Because of the fact that you're interested in the speech pathology program, it requires you to have a minor, ultimately to complement, your ultimate goals and also the audience that you're planning on working with. You do not have to select that minor your freshman year. There are some minors that are a little longer. So the sooner you know, definitely the better. And typically I would say that would be a foreign language minor in the case of Spanish, a slightly longer minor. However, there's some minors that's only 5 classes that can easily be done in a few semesters, but you do not have to have your minor selected day one coming in at Western. You have time, and you will work closely with your academic advisor. In this case, it is Jill Hamilton. She's the advisor that works with the speech pathology program. Thank you for that question. Allison, I'm gonna pick on you once again. Being that you were a transfer student, did you happen to live in the residence halls?
I have not, sorry. A lot of the other ambassadors have, if you'd like that perspective. I do know that we have a dorm where a lot of the people who are in the College of Health and Human Services as freshmen can all live together. So like your roommates can be pre-nursing majors and pre-social work and whatnot. And so I would definitely explore that when you get information about res life.
Okay, and then to that end, if you wanted to ask maybe one of our health and human services students about living in our health and human services community or health community, you could send an email to our student ambassador email, which is chhs_ambass@wmich.edu. And again, before we go off today, I will put the slide back up with all the academic advisors' contact information, along with the student ambassador email address.
We have another exciting thing, if somebody is a transfer student, there are some dorms that have their transfer floors, transfer dorms. So they're geared just towards transfer students. So if you are already 2 years in the community college and you don't want to come in and I don't want to be, you know, a freshman or whatever, you can move into I guess older, 2-year older or whatever, 3-year older, but still.
Upperclassmen living.
It's geared towards transfer students. My daughter did that. She did 2 years at a community college and then she moved in to the transfer dorm, and that really was nice for her because she had already been through some of the stress of the early college. How do I work my schedule and all of those things that freshmen start to work on right at the start. And so she was ready to move into a different place.
Wonderful. Yes, we are calling those more of the upper level housing opportunities for the upperclassmen. So yes. Allison, another question. What about engagement opportunities that you may have experienced as a transfer student, just to get connected even more to the university since you did not live in the residence hall? Would you mind sharing that perspective?
Yeah, excellent. I mean, obviously just the classroom sizes are smaller, so you get to know students that you are in class with. So that was kind of my first contact point. I've joined Eta Sigma Gamma, the public health education honorary, which I absolutely love. And so I'm friends with all the public health people. And a lot of the majors have their own clubs. And then like for speech path, a lot of them are into sign language. So there's an American Sign Language Club. So just there's plenty of variations of that. There's a lot of church and religious groups on campus that I'm a part of one of them. We have yoga in our college, so you get to see a lot of people in those types of settings. And just like the atrium, I'm a pretty outgoing person, so just talking to the people at the front desk, and I've even worked there and talked to new people as they come in. And there's so many RSOs on campus too that I couldn't even name them all. There's hundreds. So it's really easy. I think the environment of CHHS is that we all are in health and we all are pretty outgoing and used to talking to future like patients, and we have the personality that we get to know each other pretty quickly.
Yes, and I think Dr. Bob kind of showed it best in his presentation, how the different professions are able to interact together, their different roles and the different levels of care.
Absolutely. I mean, I'm friends with people in all majors. It's not like we're all cliques with our different majors. I mean, I eat lunch with speech pathologists and nursing students all the time and whatnot. Like, we don't necessarily study together, but we still hang out all the time when we're in college and between classes.
There's such a great vibe in our college, in our building, because every single major is a helping profession. So there isn't any of the cutthroat, whatever going on. It's everybody is there because they want to do good in the world, to help people. And so that vibe just generates throughout the faculty, the students, the staff, everybody. It's just nice to work in that environment. So
we have a question from Hannah on the chat, and she's asking, how long is the program to be a future PA? It is basically 6 years. So 4 years for your undergraduate and then 2 years for your graduate education. Now, I realize that some high schools have opportunities for early middle college where you can go to school for that 13th year. And you could potentially go the 13th year and have your associates. So that could cut down even the time even more so. So if that's you, I say, let's talk about that, especially if you're interested in physician assistant. I'm happy to have more of a conversation with you. But just looking at a traditional student, ideally 6 years to become a physician assistant, making great money. But we do, once again, thank you so much for taking time out of your busy day, your stay at home, staying safe day, and joining Western Wednesday with the College of Health and Human Services at Western Michigan University. We hope that once we're able to kind of get back out and resume some sense of normalcy, that if you have not had an opportunity to come and visit campus, please do. You will fall in love with Western Michigan University's campus. Yes, it's a little big, but yes, the feel of it is still small and comforting and homey. Just as Allison mentioned, You're able to interact with individuals from various majors, not only within the College of Health and Human Services, but majors throughout campus, from aviation to engineering to business. So there's still that sense of home at Western. It's a beautiful campus, a lot of green space, and our focus is really on the students and meeting them where they are and helping them get to their ultimate goal. We are truly here to support our students. We have wonderful resources available not only within our college, but also at the university. So whatever you need, student organizations, we have over 400 student organizations. If there's not a club that's there that you may have an interest yet, you can start it. You can start an RSO. So we're just new opportunities for you awaiting at Western.
And Kalamazoo is a super cool city. And we are right between Chicago and Detroit. So we get all of the big shows, the concerts, we get all of it because we are on the stopping point between Detroit and Chicago.
And Connor is asking the question whether or not, or do the OT and PT programs graduate with a master's in 6 years? Actually, that is a phenomenal question, Connor. Physical therapy actually is a program that requires a doctorate degree. So that is what we offer at Western. So for an individual who's starting out as a freshman, it's 4 years undergraduate, 3 years for graduate education for PT and OT. Because at Western, we now offer a doctorate in occupational therapy. The profession still calls for a master's at this point. However, we're anticipating in the next few years that may be changing. There's been a lot of discussion going on the last several years where it was changed, then they rescinded it to where, okay, fine, we'll stick with the master's for now, but believing at this time that the profession is going to be heading towards a doctorate degree. And Western is already ahead of it, ahead of the game. So we want to make sure that we are preparing our students for the changes that lies ahead. So with that, for both our doctorate in occupational therapy program and our doctorate in physical therapy program, those are 7-year doctorate programs. Essentially, you will receive a bachelor's of science in healthcare services and sciences, and then your doctorate degree in either of those disciplines.
And Kalamazoo also has amazing coffee shops and lots of parks and nature preserves, yoga, bar, Pilates, lots of healthy people in the community as well. So it's a really fun community to live in.
It is. I would have never thought after so many years that I would still be in Kalamazoo. It is a wonderful place to live. A lot of connections to be made. As Dr. Bob mentioned, we're right in the middle of Chicago, the commute from Detroit to Chicago. So we definitely invite you to come take a look at Kalamazoo, take a look at Western, and all the glory we have to offer, I guess. So again, one more picture for the various undergraduate program, the advisors. And also, if you wish to chat with one of our student ambassadors to hear about their experiences, we're happy to have you reach out to them. We thank you again for joining us today. Dr. Bob or Allison, would you happen to have any final words or anything for anyone?
I just want to thank you for joining in with us, and I hope to see your face in the fall. And if you see my face, is what I look like. So if you see me walking around the building, come up and say, hey, I saw you online, and let's get a cup of coffee.
Allison?
Well, thank you for the students. I know it's not always, you don't know what to expect coming into these webinars, but I'm really glad that you're here, and I look forward to hopefully talking with potential public health students, as well as getting you to one of my friends who can help you with other major specific questions and just living in Kalamazoo in general. So thanks for tuning in. I hope that we can email and maybe Zoom or WebEx one-on-one if you have more questions.
Thank you, Allison. And again, thank you so much. My name is Melinda Lockett. I'm the Assistant Director of Academic Advising for the college, and my staff and I look forward to working with you in the years to come. So please don't hesitate to connect with us should you have any questions as it relates to Western or any of the programs that you're interested in. Again, thanks so much for joining us this afternoon. Have a great day. Stay safe. Stay well.
Bye.